election. Let's ask Illinois Congressman Peter Roskam. Sir, thank you. Am I off? Am I being too hard on the president? You know, this seems like a backdoor trick. You know, the reconciliation requires only a 50 votes in the Senate plus Biden. What's the rush?
No, look, you're not being too hard. You're asking fair questions that haven't really been answered. Let's rewind the tape and go back a year ago when we really started a robust national conversation on health care. I think people actually were hopeful that Congress and the administration would focus in on three things: driving costs down, increasing accessibility by driving costs down, and dealing with pre-existing conditions. And they've listened to the president give speech after speech. They've listened to his Celebrity Sunday tour when he did all the talk shows. They listened to the Super Bowl prelude, and on and on and on. And the more they've listened, the more incredulous that they've become, that they see, to your point, that this is a takeover of 1/6 of the American economy. It is so far off the mark of where the public wants to see us go. And I think the irony is the president says he's interested in bipartisan solutions, and my challenge to the White House is, then you know what? Call a Republican bill. Call a bill that drives waste, fraud, and abuse out of Medicare. That's a consensus item. Let's get that passed. Or the president has said he's in favor of purchasing insurance across state lines. Fine, let's negotiate on that and bring that bill to the floor. But this all-or-nothing attitude, I think, is completely incongruous with where the American public has been for these past several months.
Maybe you can help us out here as well. I'm still trying to figure out, I'll probably still be trying to figure this out for weeks, where in the president's plan does it actually lower costs? Where does it give the incentives for doctors not to have all these extra charges that then eventually I'm going to be charged for by my insurance company? How does this new Cadillac tax do that? How does this new business tax do that? How does a new tax on people who are fortunate enough to make good money because they've worked hard, how does that reduce those costs for medical tests? It
doesn't bring those costs down, and that's a big part of this program. And I think what has happened is the administration and the congressional majority have been talking about bringing costs down, but when the Congressional Budget Office came in and gave their testimony on essentially this bill, the elements of this bill, back in July, they said, you're not going to bring the cost curve down, you're going to actually explode the cost curve. At that moment in the Ways and Means Committee, it was actually awkward
We're
for
just
the Democrats.
paying for everybody else.
Congressman,
yeah, that's it exactly.
Congressman, I was reading through the transcript when you attended the healthcare summit. You spoke to President Obama. You mentioned how you used to work with the president when he was a senator in Illinois. You worked together on the death penalty situation. You're talking about, and you told the president, how different things are today when you're talking about healthcare. When it was the death penalty situation, the president said there's a problem, let's fix it. And with the healthcare situation, he started that way, but now you said it's, quote, turned into what is it going to take for you Republicans to vote for our bill?
Yeah, that's it exactly. I had a very different experience with then State Senator Barack Obama, who worked with Republicans on incremental changes on very controversial subjects. But we did it, we worked together, we came at it with a clean sheet of paper, to coin the phrase that people have been talking about for the past couple of days, and we passed those bills unanimously. Now, what's different today is basically there's been this completely mismanaged attempt by the part of the majority to literally take over the healthcare system by the federal government. They have been recoiled by the American public, and it's clear as can be through the elections in New Jersey and Nevada and Massachusetts and all of the polling. Folks have said, we don't want this bill. We want a step-by-step approach. And so the invitation to the president is, do this and break this process down, because if you create this false choice of doing it all or doing nothing, actually not much gets done. And that's the squandered opportunity in my view. The American public says we need to make cost changes. Let's focus in on cost.
Let's do this. Let's take November 2010 when the midterm elections hit and everyone in the House is up for re-election. What's better for the Republicans right now? A passed health care reform bill that basically the Americans don't want, and therefore they can campaign on, hey, you pass something we don't want, or a failed one, and they say, hey, look, you can't get anything done. Let's switch over, make the House Republican again?
Well, I think that what is actually better for the country, and that needs to be all of our top priority, is to not have this bill put into law. Because if this bill is put into law, it's going to fundamentally increase costs, it's going to decrease choices, and it's going to put a hamper on medical innovation in this country, which we have all been the beneficiaries of. And I think if the Democrats decide to be so provocative, to come at the American public and say, you know what, we've heard you, but we're ignoring you, and we have a wonderful plan for your life, and just sit back and we're going to tell you what's going to happen to you. I think the American public will rise up in November in ways that we haven't seen in a long,
Congressman,
long time.
the American public, if they're against it, they need to rise up now, and they need to reach out to their lawmaker and call them with their opinion right now. Let's go back to this reconciliation, how the vote is going to be taken, the simple majority. All day people have been going back and forth. We talked about it yesterday, how it has been used before. It has been used by the Republicans. What is your counter to that everybody uses it? What's your counter to that argument?
It has been used in the past largely to reconcile numbers, right? And it has never been used at something at this level, to literally take over 1/6 of the economy. So just go back and replay the tape from a few years ago when then U.S. Senator Obama was criticizing the reconciliation process. And the list is just complete with a whole host of folks that have done an about-face. But my sense is that, look, even within the past 4 hours, leading Democrats in the House have said, oh, we've got the votes to pass this thing, and now 4 hours later they've said, well, we're gonna pass it when we decide to pass it. So this is very much in play. I don't think this is a done deal. I think that the president has convinced himself that the American public, just if they hear about it one more time, they're going to have this aha moment and say, oh, I didn't realize that was in the bill. Now I'm for it. Look, the public is sophisticated. They're tracking on this. They understand this bill, and they have rejected it.
Well, who knows? Maybe those lawmakers heard from the public within those 4 hours. Congressman Peter Roskam, thank you so much for joining us for Happy Hour.